Committee to order and ask anybody to declare pecuniary interest either now if it arises down the agenda. Information items. A, call volume.
Thank you, Mr. Chairman. The document before you has been pre-circulated. Of particular note in this document is the increase in Code 4 and Code 8 calls. Code 4 calls are determined or are deemed those urgent, that is of danger to life and limb, and Code 8 sees the ambulance relocated in an area where resources are depleted. The top 4 call types in this period have been 13% were unwell and weakness, 9% shortness of breath, and 8% musculoskeletal injuries. 5.5% were for chest pain. It is of note that of the 2,900 Code 4 calls for this reporting period, some 800 were canceled prior to arrival or were non-transports as a result of patient's refusal, patient in the custody of police, or patient transferred by another vehicle. That's it for the highlights of this report.
Okay, thank you. Any questions or comments? Hearing none.
Mr. Chair, the second information item pertains to the Canadian Trauma Acuity score response time data. This document before you has been pre-circulated. The report shows that the CTAS patient classifications, that by that classification system since 2016, essentially all response times have improved, with the exception of CTAS 5, which are defined as non-urgent patients who could have treatment delayed or be referred to other parts of the healthcare system for treatment. By community, the time percentages vary widely based on the call number and geography, particularly those that have low call volumes. And sir, that's the highlights of this report.
Okay, thank you. Any questions, comments on that report? Hearing none.
Mr. Chair, the third information item pertains to the Canadian Trauma Acuity Score Time Performance Plan. The document before you has been pre-circulated. This document is required annually by the Ministry of Health and Long-Term Care. The document describes our response time targets and forms a key performance indicator for our service to the ministry. We recommend that this plan remains unchanged from 2018 based on current performance efficiencies.
So this is a recommendation, I believe, Michael?
Yes, sir.
You've seen the staff recommendation. Do I have a mover and seconder? Ann, second by Mike.
And my apologies for that being said to be an information item.
That's okay, no problem. Any further discussions? All those in favor, opposed if any, that is carried. Thank you.
And that's it, sir.
Just one information item, and I mentioned this to Kelly. On Monday, Ann and I attended the Bruce Community Futures Development Corporation's annual general meeting. They had a guest speaker there, Rick, I forget his last name already, and he was there talking about paramedicine and the things that are going on with our land ambulance folks, and I would recommend that we have a visit from is it Rick Winter was his last name? Anyways, if he would come and make a presentation. The bottom line is Essex County, by implementing paramedicine, has actually saved $3 million in ambulance services and freed up the equivalent of 2 ambulances for a full year. So it was really interesting. I know they've been here before, and I know one of our challenges is that maybe we don't have, not maybe, but that we don't, Kelly, correct me if I'm wrong, the qualifications to have this service. But at the end of the day, what this group is trying to do is get the province to pay for the training for these paramedics. And so I think it's worth having the group come and have a discussion with us. Ann?
Yes, I think it's good to listen. He's very detailed, gives you a complete picture. But it's all about money. Will the province keep putting money into it, or will it become another program? And we know various, various organizations or whatever they have a certain amount of government funding, and then, okay, you're on your own. That's my concern.
Kelly?
Through you, Mr. Chair, certainly Director McKay can do that outreach and invite them to come. I would also recommend that at the same time that we, as staff, provide a report on our existing community paramedicine that we do. We do have a program. It's not as robust as the program at Grey County, and that goes back to the advanced care paramedic versus primary care paramedic.
Yep. Okay. Motion to adjourn. Robert? Dan? All those in favor? Opposed if any? That's carried. Thank you.